Goeiedag! Good day, fellow South Africans and citizens of the world. And I'm renaming the Ministry of Health in South Africa the Ministry of Death in South Africa. And before I tell you what's going on with coronavirus and COVID-19 in South Africa, they had over 9,000 new infections in the last 24 hours. Think about that. 9,000. Highest ever in the country. And that curve is just keeping on going like this. Now, why do I refer to the Ministry of Death? Well, I'm going to tell you a very personal story. Then I'm going to give you a broader brush as to how absolutely incompetent the ANC are in managing the public health system. Let's start off with the story of General Isaac Van Zyl. Okay, Isaac is a very prominent personality in South Africa. A few weeks ago, he had a couple of heart attacks, and as a result, it was diagnosed that he should go and have triple bypass. He went into the Steve Biko hospital, and that's in Pretoria, very big hospital, and he was told that he would be operated on a Monday, and thank God he didn't have it done in that public hospital, because you don't come out of there alive. And because of their incompetency and the left foot didn't know what the right foot was doing, basically the operation was cancelled, and they said, because of COVID-19, you're going to the back of the queue. We'll get back to you when we're ready. Now, remember that Isaac was in a very precarious condition. He had a very, very unstable heart. Anyway, I had him on my live stream very early this week, and he complained that he was not feeling well. And the very next day, he had a major heart attack. And then the day after that, he had another major heart attack. In the meantime, we'd been starting to try to raise funds for Isaac so that he didn't have to go into the public health system, he could go to a private hospital. So, some incredibly generous subscribers put forward about R500,000 to fund his costs in the private hospital. He was put into the private hospital, and they said, look, we need your report on your heart. And that report is called angiography report, which Steve Biko Hospital had. And despite numerous attempts to go and get this report, which he needed to have the heart operation done, the doctors at Steve Biko Hospital refused. They refused to hand over this report. Now, for Isaac to go and have another angiography report done was incredibly dangerous, because he had only had it done a couple of weeks before. They pump you with iodine. You can cause liver failure, all sorts of stuff if you put too much of that shit in your body. But no, the Steve Biko Hospital said, we are not giving you the angiography report. And without that, the private hospital could not proceed and give him the triple bypass operation. So his family sought legal help. They got a court order. Just a couple of days ago, they got a court order, and it said in that court order that the hospital must hand over that angiography report. Let me show you that court order. Okay, so armed with that court order, the cardiologist from the private hospital went to the Steve Biko Hospital with a court order and said, can I please have the angiography report? And there was a doctor there. And he said, no, we're not going to give it to you. But the cardiologist said, but hang on, we've got a court order. And he basically, this doctor at Steve Biko Hospital, who was an African, basically put his middle finger up. His name was Dr. Pomelo, apparently. And he said, no, you're not going to get it. So this cardiologist from the private hospital went back to his hospital and had to tell Isaac that the Steve Biko Hospital had refused to hand it over. So the current situation right now is that the family has had to get a sheriff to go to the Steve Biko Hospital to demand, by terms of the court order, that that angiography report be given to Isaac's doctors. This is where it stands right now. This is how absolutely sick the hospital system is in South Africa. Remember, this is an African doctor who's refusing to hand over this report that Isaac needs to have the operation to save his life. Whatever happened to the Hippocratic Oath? I don't know. I think that this really stinks, and I think this is going to make news in the media. In fact, today, I believe Die Bild are looking at doing a story on this. But, you know, having said that, Isaac is not alone. This is why I call the health department the death department, because you go into a public hospital with a broken finger and you die there. Lots of people die there for unexplained reasons. The hospitals are filthy. They're overcrowded. Everything about them is just wrong. The public health system in South Africa is a death trap. Not only that, let me give you an update on COVID-19. How well the ANC have managed the COVID-19 pandemic in South Africa. Now let's remember, just a few weeks ago, the World Health Organization were singing the praises of Ramaphosa and South Africa in the way they'd handled COVID-19. Well, haven't they got egg all over their face now? Let me tell you why. Professor Alex van der Heever writes that the government could have been in control of the COVID-19 pandemic, but chose not to be and has instead squandered resources, leaving options limited. Now let's remember, just a couple of weeks ago, we reported that personal protective equipment and swabs and face masks and all these things, which had been ordered by the various health departments around South Africa, had been hugely overpriced. Hugely. Like 400% markup. The hospital could have gone to a local supplier and bought it for about a quarter of the price that they paid in bulk to these little shelf companies that the ANC cadres set up, and they got the order. And of course, what happened was all they did was they placed a purchase, or the hospital placed a purchase order with this little BEE compliant shelf company run by a well-connected ANC cadre. The ANC cadre had a big smile on his face while he put 3/4 of the money into his own bank account and then transferred the rest to a supplier who the hospital could have dealt with in the first place directly anyway. Placed the order with the supplier, and the supplier delivered the goods directly to the hospital. So what did the middleman do? He basically stole millions of rands. This is going on all over the place. Just yesterday I was reading a report where this is a completely different area. Jojo tanks. They were charging 28,000 rand per unit with Jojo tanks, when you could have put these Jojo tanks up for something like 4,000 rand. Same thing. The education department places an order with a well-connected shelf company run by one of the ANC cadres that's Black Economic Empowerment compliant. The magic words for theft. The purchase order goes to this little BEE shelf company. They put a huge markup on. which the education department pay, they go and then, the shelf company that goes then and places an order with the supplier of the JoJo tanks, and they get delivered direct to the health department. And of course, the costs that the shelf company or the BEE compliant shelf company has paid is like 20% of what the government paid their mate. And of course, within the mix, they're the backhanders, to the guy back at the education department and the guy at the hospital. This is how it works in South Africa right now. This is why there is no accountability. Let's continue with the Ministry of Death. The MEC for Health in Gauteng talks of predictions and the National Health Minister of a coming storm. These allusions leave one with the impression that someone is in charge and knows what is happening. But is this the case? Or is this just spin to avoid accountability? Now, you might recall weeks ago, way back in early April, I was saying this lockdown will never work because the taxis are a petri dish for spreading the coronavirus. The townships are a petri dish for the spreading of the coronavirus because there's no social distancing. And then we have so much video photographic evidence of people milling around in the townships, no police around, but if you're a white woman walking your dog by yourself in the isolated streets of a Cape Town suburb, you get set upon by 7 police and get arrested. While this is going on in the townships, it is absolutely crazy what is going on in South Africa. You cannot make this shit up until you can't make this shit up. Anyway, let's continue. Understanding the COVID-19 trajectory in South Africa requires that we interpret events to date to better understand the way forward. On the 27th of March, a generalized lockdown was introduced to suppress transmission, supposedly to prepare the health system to contain the local epidemic through prevention measures and to ensure that sufficient health services would be available for a contained rather than a full-blown outbreak. It was apparently well understood that an uncontained outbreak would overwhelm whatever services are prepared. There were therefore 2 basic strategies that needed to be implemented. First, focus on prevention, which around the world is premised on a strong system of test, trace, and quarantine, together with physical distancing. There's the problem. This is why that lockdown failed from day one. Health protocols at high-risk communal spaces, i.e. shops, schools, employers, public services, and the occasional targeted lockdown should suppress the epidemic to manageable levels. Second, is medical treatment for those that do get infected. For COVID-19, serious morbidity requires hospitalization, with about 36% of these in need of critical care. If prevention fails, these services inevitably get overwhelmed, even in the wealthiest of countries. The most reasonable strategic approach, therefore, was to invest in prevention rather than treatment, with the latter only needed as a fail-safe for cases that fall through the cracks. Well, the cracks were so wide, they were chasms, and everybody fell through them, because the Ministry of Death didn't have a friggin' clue what it was doing. Yeah, Zweli Mkhize gets up there and he says, it's just like the rest of these goons who run the ANC government. They don't have a friggin' clue. They are clueless and corrupt. South Africa had from January 2020 to prepare its strategy. South Korea, for instance, immediately developed tests and coordinated public and private parties to provide capabilities for expanded and rapid contact tracing. As a consequence, they avoided the need for a generalized lockdown or for expanded treatment facilities. But in the country which couldn't organize a barbecue in a park, even when it's one of those ones you just put a coin in to turn it on, and I'm talking about South Africa, guess what happened? The predictable. It all went horribly pear-shaped, didn't it? Oh my God. You know, when you got the kids running the classroom and trying to act like adults when they've got an IQ factor that it's so low, it's around my feet. South Africa, therefore, not only had time to prepare for prevention, but more importantly had the opportunity to review the strategies of every country on the planet. However, South Africa did not throw everything at prevention. From late March, the government implemented an anemic testing program that was at that stage dwarfed by the private sector. The idea was to get up to scale by the end of April, 36,000 tests per day, with a rapid turnaround. This was the must-not-fail part of the strategy. However, by 30th of April, only 11,576 tests per day were achieved, with a generally poor turnaround time of up to 7 days. By the 29th of June, 2 months later, the National Health Laboratory Services, or NHLS, of the state's NHI, National Health Insurance Scheme. What a complete, utter failure! Fail! You know what the Minister of Death can do? He can go and pog my horn. Idiot. Anyway, let's get on with this. The National Health Laboratory Services, or the state's NHI for Laboratory Services, declined to 8,331 per day from a previous 11,576. They're clueless, absolutely clueless. The government has attempted to explain the failure to achieve testing at scale to bottlenecks in international supply chains. However, despite accessing the same global supply chains, the private sector tested 21,580 on June the 29th and regularly maintains over 20,000 per day. As of 29th of June, the private sector had completed 702,236 tests in comparison to the public sector's 649,000. Look, I have had so many reports of people who've gone to the hospital who are not feeling well and for a COVID-19 test. These are public hospitals, and they get turned away. They said, no, we haven't got any tests available. No, you can't do it. No. This is the same sickos who are doing this shit to Isaac Van Zyl. You know, this is why it's the ministry of death, guys. It's not the ministry of health. It's a ministry of death. While South Africa's total daily numbers of tests currently ranges between the fairly respectable 35,000 to over 40,000, which is probably in the range to achieve preventative effect, provided the number of infections does not rise too high, these tests do not form part of a unified prevention strategy. The public sector chose instead to cut itself off from private testing and go it alone. In doing so, the relevant government decision makers limited opportunities for strategic testing to whatever the NHLS could achieve. The government also inexplicably failed to draw on the testing capabilities of the universities. Tied at the hip to testing is contact tracing, which is critical to the objective of separating otherwise undetected positive cases from the uninfected population. Contact tracing uses access to our smartphone information, has, however, been buried in secrecy, with no validated information on how many contacts have been reached and after what time period. Well, let me tell you something. It's not happening. As I said before, this ANC government couldn't organize a barbecue. You know, it's a complete disaster. Every sector of the South African government is a complete and utter disgrace in every aspect of the word. Some spooky facility has been set up at the CSIR, which no one can provide any information on and no one is permitted to inspect. As it appears that provinces are largely contact tracing the age-old way, boots on the ground and the telephone, it is unclear what purpose the CSIR arrangement services give. Contact tracing, or just to spy on the general population? With no transparency or independent governance framework for this platform, it has become very difficult to ascribe to it a proper purpose. Why was all of South Africa's technical capacity, public and private, not thrown together to establish a high-tech national contact tracing platform? This could have been done at no cost to the government. Many private sector players have indicated to me that they would have provided services for free. Also, why was no contact tracing application developed? This could have been done in a matter of weeks in March, and for free. South Korea's had theirs in January. We could have used theirs. After all, we use their smartphones. To protect privacy, a transparent governance framework could have been created. But once again, I say, use the old park adage. Here, the barbecue. But instead we have secrecy, no governance and no evidence of performance. If our testing and contact tracing platforms actually delivered, the final evidence would be found in the outcome. Prevention achieved. So what have we achieved? Now, while we're talking about that, let's remember, about 6 weeks back, quite early in the piece, there were those 2 young doctors who were self-isolating in Limpopo. Remember that? And then the local minister of death in Limpopo demanded that they go into quarantine against their will. Remember that? This is the idiocy, the L factor missing in action in this ANC government. You know, they're clueless, absolutely friggin' clueless. I don't know how many times I have to say that. Anyway, let's go and carry on. We implemented a lockdown that devastated the economy, killed the economy. But according to Ramaphosa, everything is just fantastic because it's going to bring in that thing called black economic transformation, which means the death of South Africa's economy. Hopefully we bought something of value for the roughly 1.2 trillion rand and growing price tag this has entailed. For that price we could have bought roughly 400,000 ICU beds, or stated differently, around 800 hospitals with 500 ICU beds each. We could also have funded the running costs of roughly 171 million bed days with a normal mix of general and critical care beds. This would fund 469,667 hospital beds over a 12-month period. But the ANC cadres had their heads so deep in the trough. Guess where all that money went? Well, have a look at all the flashy new BMWs, the Pontiacs, all these expensive cars that are being driven around by the new rich, the Nove Riche, the guys who own those little shelf companies. On the prevention side, we could have purchased 4.1 million tests per day for an entire year. From March, the government, however, failed to implement the testing and tracing strategy at scale, failed to implement contact tracing at scale, and even failed to seriously expand bed capacity. It has taken until July to possibly access private hospital beds in one province, the Western Cape, which they may not need after all. The Eastern Cape, which is in full-scale collapse, has not activated any public-private arrangements. Far from curtailing the epidemic, as has occurred in other countries, the lockdown in South Africa saw new infections steadily increase while under level 5. Clearly, many of South Africa's densely populated communities were extremely vulnerable to COVID-19 and required positive support to aid prevention rather than a lockdown. Such an approach required proper messaging and sensitive communication, testing and tracing, decent quarantine facilities, proper sanitation, free masks, a well-communicated approach to minimize gatherings, and a well-considered approach to bulk transport. Instead, communities were subject to brutalization by security forces and the police. During much of May and under lockdown, the Western Cape showed a steady increase in new cases. They were, however, attempting to implement hotspot targeting and smart testing and tracing. Key parts of the strategy, however, had to be abandoned due to NHLS backlogs, with tests taking up to 2 weeks to come back. Nevertheless, even with a change in focus, from around 8th of June, new cases in the Western Cape appear to be in slight decline, a trend that has continued into July. As the remaining uninfected population in the Western Cape remains very largely a downward trajectory, is either a consequence of the prevention program or bad data. As the mortality data confirms this trend, it appears that prevention has worked. Had it failed, the Western Cape would face horrific mortality and overcrowded hospitals in both public and private sectors. The new infection trajectories apparent in the Eastern Cape and Gauteng are therefore not the expected trajectories that were projected all along. Surprising as it may seem, the SARS-CoV-2 virus is not a computer model. It is communicated between human beings in conditions conducive to transmission. If transmission is not interrupted through behavior modification and implemented prevention programs, it will spread. What we are experiencing in these two provinces, and may experience in many of the others, is nothing more complicated than a failure to prevent new cases. All around the world, as with the Western Cape, the interjected local epidemics are entirely reliant on prevention strategies, not herd immunity, where sufficient numbers of people have been infected such that the virus has got nowhere to go. Models, at least the South African ones, only peak when some version of herd immunity is reached, with the achieved threshold heavily influenced by assumptions regarding asymptomatic and untested COVID-19 positive cases. Through the manipulation of these assumptions, you get to pick your peak. In real life, the peak is actually achieved well below herd immunity by prevention strategies. So why is the Minister of Health, or Minister of Death, and the Gauteng MEC for Health constantly referring to expected surges? They are referring to models that supposedly predict what we are seeing. This plainly seeks to create the impression that the Minister and various MECs were not in control of events. In some respects this is true. They were and are not in control. But in contrast with other natural disasters, they could have been in control, but instead they chose not to be. Our resources and options were squandered. The consequence of these choices are now very much before us. While there will no doubt be a reckoning in future years, the government now needs to seriously change tack and begin doing its job, rather than just pretending. Well, you got a bunch of goons in there. That's the trouble. You know, they might say wonderful things and speak as if they know what they're talking about, but for people who say things like, you have blood tests to check to see how much blood you've got in your alcohol, and those sort of comments, these guys are just clueless. People are dying, and our frontline workers are sacrificing their lives to face a preventable onslaught of patients. It is still not too late to implement effective prevention programs, but it soon will be. Now, I just get back to the case that I spoke of at the very beginning, General Isaac Van Zyl. We have an army of people out there who are fighting to get Steve Biko Hospital to abide by a court order demanding that this report be released to his cardiologist so that they can perform his triple bypass operation on him. But they're refusing to do so. It is quite extraordinary. I'm going to call the health department in South Africa now the Ministry of Death, because they are completely disgraceful. All right, guys, please remember to subscribe to be kept informed. Most important of all, please pray for General Isaac Van Zyl, guys, okay? Please pray for Isaac. Please remember to ring the bell twice. Click all to get all the updates. Please like this video, please share this video, and above all, please stay safe. Bye for now.